Have you ever wondered about the challenges of accessing private psychiatry in the UK and Europe? It might seem daunting, but we're here to make it less so. When it comes to mental health, time is of the essence, yet long waiting times in the National Health Service often stand in the way of prompt care. It can take weeks, sometimes even months, to secure an appointment with a psychiatrist. This can be frustrating, especially when you're already dealing with the stress of mental health issues. Now, imagine you're in a foreign country, trying to navigate a healthcare system in a language you're not fluent in. This is a reality many expats face across Europe. Language barriers can make it even more challenging to access quality care, let alone find a psychiatrist who speaks your language. Then there's the complexity of insurance coverage. The world of insurance can be a labyrinth of policies, procedures, and fine print. Understanding what's covered, what's not, and how to claim can be a daunting task. In some cases, you might have to pay up front and seek reimbursement later, adding yet another layer of complexity. That's where private psychiatry comes in. It offers a more personalized approach to mental health care, often with shorter waiting times. Private clinics like BritMed have partnerships with major insurance companies, including AXA, Bupa, and Aviva. This means that direct billing is often possible, simplifying the insurance process. Private psychiatry also offers the flexibility of online consultations. This can be a game changer, particularly for those living in remote areas, or those who prefer the convenience of accessing care from the comfort of their homes. It also opens up the possibility of consulting with English-speaking psychiatrists, no matter where in Europe you're located. Navigating these challenges can be overwhelming, but with the right information, it doesn't have to be. So, stay tuned as we delve deeper into the world of private psychiatry in the UK and Europe. We'll demystify the booking process, insurance coverage, online consultations, and more. Because when it comes to mental health, knowledge truly is power. Check insurance coverage, link below. The first step in accessing private psychiatry is understanding the booking process. It's not as intimidating as it might sound. In fact, it's been streamlined to make it as straightforward and user-friendly as possible. Let's start with the self-referral process. You don't need a referral from a general practitioner to book an appointment with a private psychiatrist. You can refer yourself. This means that you can bypass potentially long waiting times and get the help you need more quickly. Once you've decided to seek help, the next step is the initial assessment. This is an essential part of the process. During this session, the psychiatrist will get to know you, understand your symptoms, and begin to formulate a treatment plan. This is your opportunity to express your concerns, ask questions, and establish a rapport with your psychiatrist. You might be wondering about the frequency of sessions. While this can vary depending on individual needs, it's common to have weekly or fortnightly sessions at the beginning. As you progress, these sessions may become less frequent. However, the frequency of these sessions is something you'll discuss and agree upon with your psychiatrist. Now, how do you actually schedule these appointments? Well, the beauty of private psychiatry is its flexibility. You can book your appointments online or over the phone. Online booking systems are typically available around the clock, allowing you to schedule your sessions at a time that suits you best. Telephone bookings, on the other hand, offer a more personal touch, with trained staff available to answer any queries you might have. In summary, the booking process involves self-referral, an initial assessment, and regular sessions that can be booked online or over the phone. It's all about making it as easy and convenient as possible for you to access the care you need. Remember, the booking process is your first step towards better mental health. Insurance coverage can be a tricky part of accessing private psychiatry, but it doesn't have to be. Let's break it down. There are two primary types of insurance coverage: direct billing and reimbursement. Direct billing is where the provider, in this case, a private psychiatric clinic, bills the insurance company directly. You, as the patient, don't have to worry about paying up front and then waiting to be reimbursed. It's a hassle-free process that many people prefer. On the other hand, reimbursement means you pay the provider up front and then claim the cost back from your insurance company. It's a bit more work on your part, but some people prefer it as it gives them more control over their healthcare expenses. The good news is, BritMed, a leading private mental health clinic in the UK, has partnerships with major insurance providers, including AXA, Bupa, and Aviva, among others. This means they can offer both types of coverage, giving you the flexibility to choose what suits you best. But here's a piece of golden advice. Always check your insurance coverage before booking a consultation. Each insurance policy is different, and what is covered can vary significantly. Some policies may cover all psychiatric services, while others may only cover a certain number of sessions or certain types of treatment. Also, keep in mind that some insurance companies might require a referral from a GP or another healthcare provider before they'll cover psychiatric services. It's always best to know the ins and outs of your policy to avoid any unexpected costs. Now, if you're wondering about the quality of care you'd receive when the insurance is involved, rest assured that it doesn't affect it. BritMed, for example, prides itself on offering top-notch psychiatric care, regardless of how the services are paid for. So, there you have it. Understanding your insurance coverage can be a bit like navigating a maze, but once you've got the hang of it, it can save you a lot of stress down the line. Remember, the goal is to get the help you need without having to worry about the financial aspect. Understanding your insurance coverage can save you a lot of stress down the line. So, do your homework, ask questions, and ensure you're fully covered for the care you need. In the era of digital health, online consultations have become an integral part of private psychiatry. They've revolutionized the way we access mental health services, and for good reason. Quality, convenience, and accessibility are at the heart of this innovation. When we talk about quality, we're referring to the standard of care that you receive. With online consultations, you don't need to compromise on this. You'll be interacting with experienced psychiatrists who are well equipped to provide you with the help you need, be it therapy or medication management. The virtual space does not diminish the quality of care. It merely changes the way it's delivered. Now let's talk about convenience. Picture this. You're having a stressful day at work, or maybe you're feeling overwhelmed at home. The last thing you want to do is commute to a clinic or hospital. With online consultations, you don't have to. You can talk to your psychiatrist from the comfort of your own space at a time that suits you. It's mental health support that fits into your life, not the other way around. Which brings us to our next point, accessibility. When we say that online consultations are accessible, we mean it in every sense of the word. You could be in the heart of London or in a rural town in France, and you'd still be able to access the same quality mental health care. This is particularly important for those who live in areas where psychiatric services are limited. BritMed has invested in a robust online consultation infrastructure to ensure that you receive seamless care. Our platform is user-friendly, secure, and designed to protect your privacy. We understand that seeking help for mental health issues can be a sensitive process, and we've taken every step to make it as comfortable for you as possible. To sum it up, online consultations have taken private psychiatry a step forward. They're about meeting you where you are, both physically and emotionally. So whether you're dealing with everyday stress or navigating through a mental health condition, remember, you're not alone. Online consultations are a convenient way to access mental health care, no matter where you are. Living abroad can pose additional challenges in accessing mental health care, but there are solutions. One of the most common issues expatriates face is language barriers. It can be hard to find a mental health professional who speaks your language fluently. In response to this, many private psychiatry services in the UK and across Europe offer English-speaking psychiatrists. This ensures that communication is clear and effective, allowing you to express your concerns and receive appropriate care. Another challenge expats often face is geographical location. You might be wondering, how can I access mental health services when I'm constantly on the move? Well, the good news is, with the rise of digital health, you're no longer confined by physical boundaries. Many private mental health clinics now offer online consultations, which means you can connect with your psychiatrist from anywhere in Europe. This flexibility makes it easier to maintain consistent care, even when your lifestyle involves a lot of travel. Additionally, certain clinics, like BritMed, go a step further by offering multi-location access. This means that they have partnerships with clinics in different European cities, allowing you to continue your treatment seamlessly if you move. These services not only cater to the unique needs of expatriates, but also ensure that living abroad doesn't mean compromising on mental health care. So, whether you're a Brit in Berlin or a Londoner in Lisbon, remember, being an expat should not limit your access to quality mental health care. Let's talk about repeat prescriptions, a crucial aspect of ongoing mental health treatment. Repeat prescriptions are a common part of many treatment plans. They allow for continuous, uninterrupted access to necessary medication, which is especially important when managing mental health. Now, how does one go about getting repeat prescriptions? Well, it's simpler than you might think. Once your psychiatrist has established a treatment plan, they can issue a repeat prescription. This means that you can continue to receive your medication without needing a new prescription each time. But what about those of us in Europe, away from our UK-based psychiatrist? How do we navigate the logistics of obtaining our prescriptions? This is where the beauty of online consultations comes in. With online consultations, your psychiatrist can issue your repeat prescription electronically. This can then be sent to a pharmacy in your current location, be it Paris, Berlin, or Madrid. It's as easy as logging into a consultation, discussing your medication needs, and then picking up your prescription from your local pharmacy. This process not only simplifies medication management for those living abroad, but also ensures that your treatment plan continues uninterrupted, regardless of where you are. It's all about continuity of care, and at BritMed, we understand the importance of this continuity in managing mental health effectively. Repeat prescriptions are a key part of your treatment plan, ensuring continuity of care. Finally, let's address the elephant in the room, the costs of private psychiatry. It's no secret that private care can be more expensive than public healthcare systems. In the UK and across Europe, fees for private psychiatric consultations can range from £75 to £200 per session. Now, this might seem steep, but let's not forget the added benefits quicker access to care, flexibility of appointments, and personalized treatment plans. If you're covered by private health insurers like AXA, Bupa, or Aviva, they may shoulder a significant portion of these costs, if not all. Some even offer direct billing arrangements, sparing you the headache of reimbursement processes. In the realm of online consultations, BritMed provides a robust infrastructure ensuring quality care, and their multi-location access simplifies prescription logistics across Europe. While costs can be a concern, remember that investing in your mental health is priceless.